Hello. This is Rafael Palunas. If you're watching this video, it means you or someone you care about is struggling with a very delicate and unpleasant problem. It's a feeling that turns your life upside down. The constant running to the toilet, the loss of confidence, the fear of finding yourself in an awkward situation because of a sudden, overpowering urge that's simply impossible to ignore. The sensation that your own body has gone rogue. Does this sound familiar? So you are not alone. Millions of people face this, and very often the culprit behind this chaos is a common resident of our intestines. That's right, the very same E. coli. A microbe that usually helps us digest food, but when it ends up in the wrong place, it turns into a real saboteur. Today we're going to talk in detail, in simple words, about how a tiny bacterium causes a huge problem, and most importantly, what to do about it. Get comfortable and let's begin. Let's imagine our bladder. Not as some abstract organ, but as an elastic, intelligent reservoir. It's made of muscle and lined from the inside with a delicate, smooth mucous membrane. Its job is to accumulate urine produced by the kidneys and, on the brain's command when it's full, to empty itself calmly and completely. It's all orderly, civilized, and under control. That's the norm. Now, imagine that a stranger infiltrates this sterile, perfectly clean reservoir. E. coli. How does it get there? Most often in the most mundane ways. Due to anatomical specifics, incorrect wiping technique, wearing tight underwear, sometimes even after intimacy. The journey is short, from the intestines to the urethra, and from there straight into the bladder. And so, the bacterium finds itself in a new, comfortable environment. It doesn't just float there. Like a climber, it uses special filaments to latch onto the delicate mucous membrane, and it begins to multiply at an incredible rate. The body, of course, cannot allow this. It sounds the alarm. A powerful reaction is launched: inflammation. What is inflammation really? Swore. A real battle begins at the site of the bacterial invasion. Blood rushes to the walls of the bladder. They become red, swollen, porous, and incredibly sensitive. Imagine you've scratched your skin and then poured lemon juice on that scratch. That's roughly how the lining of the bladder feels. And this is where the main issue starts. Normally, when say 300 to 400 milliliters of urine accumulate in the bladder, its walls begin to stretch gently, and a signal goes to the brain. It's time, but you can wait. Now, imagine that these walls are inflamed, covered in microscopic wounds. Now, even 50 to 100 milliliters of urine is like a drop of that lemon juice on the scratch. The brain receives not a calm signal, but a panicked, distorted scream. Alarm! Empty immediately. Now, this scream is that very imperative, uncontrollable urge. Doctors call it urgency. It's not just needing to go. It's the feeling that if you don't get to a toilet within the next minute, a catastrophe will happen. The brain sends a command to the bladder muscle, the detrusor, to contract immediately, right this second, regardless of the circumstances. That is the root of the problem. This is often accompanied by other joys of war, a burning sensation during urination, because urine, like salt water, irritates the inflamed mucosa, a feeling of incomplete emptying, sometimes even pain in the lower abdomen. The body is trying its hardest to flush out the uninvited guests. Now for the most important question: what should you do? How do you stop this civil war inside your body? The first, main, and golden rule is no self-medication with antibiotics. Please remember this. What? Because E. coli is a cunning bacterium. There are dozens of its varieties, and they have different sensitivities to different antibiotics. By taking a random pill, you might only make things worse. You'll kill the weakest bacteria while the strongest, most resistant ones will survive. They will multiply, and the next time that antibiotic won't work anymore. Doctors call this antibiotic resistance. You will have cultivated a superbug with your own hands, one that will be very difficult to deal with. Therefore, step number 1 is a visit to the doctor. To a general practitioner, or even better, to a urologist. Don't be embarrassed. For a doctor, your problem is a common work situation. They will give you a referral for 2 key tests. 1. A general urine test. It will show if there are traces of war in the urine, white blood cells, the soldiers of our immune system, which cause the inflammation. 2. A urine culture with an antibiotic sensitivity test. This is the most important analysis, the strategic map. In the lab, your urine will be placed on a special nutrient medium to see what grows. After a few days, it will be clear. Yes, it's E. coli. And most importantly, it will show which specific antibiotic works best against it. It's like finding the right key to a lock. And then, with these results in hand, the doctor will prescribe a targeted, precise strike. A short but effective course of the right antibiotic. It might be monurol, which is taken as a single dose, or another drug for 3, 5, or 7 days. It's crucial to complete the entire course, even if you start feeling better on the second day. Otherwise, the surviving bacteria will rally again. And what can you do yourself to help right now, while you're waiting for your doctor's appointment or alongside your treatment? Become a kind ally to your bladder, not a tyrannical master. First, flood the enemy with water. Yes, the simplest and most effective way is plenty of fluids. Drink 1.5 to 2 liters of pure water a day. Not tea, not coffee, not soda, but water. You can have unsweetened cranberry or lingonberry juice. The acidic environment they create is unpleasant for E. coli. A generous flow of urine will constantly flush bacteria out of the bladder, preventing them from attaching to the walls. Imagine you're constantly washing them away with a powerful stream of water. Second, create uncomfortable conditions for them. Give up everything that irritates the already inflamed walls of the bladder. Forget about spicy, salty, smoked foods, marinades, alcohol, and chocolate. It's like not rubbing salt in a wound. Your diet should be gentle. Porridge, stewed vegetables, non-acidic fruits, boiled meat. Third, calm the spasms. Heat helps relax spasming muscles. You can place a warm, not hot, heating pad on your lower abdomen for 15 to 20 minutes, or take a warm shower. This will temporarily relieve the agonizing urges. But remember, if there is visible blood in your urine or if you have a fever, do not apply heat to your lower abdomen. Fourth, give it rest. Your body is fighting an infection. Don't interfere. Avoid heavy physical exertion and getting chilled. Give yourself a chance to rest. And one more important piece of advice: don't hold it in. When you feel the urge, go to the toilet. Don't try to train your bladder by force during the acute period. Your task right now is to help it clean itself out. So let's summarize. Uncontrollable urination is not your fault, and it's not a life sentence. It's a symptom. An SOS signal from your bladder when it's at war with bacteria, most often E. coli. The path to recovery is clear. Step 1. Go to the doctor without embarrassment or fear. Step 2. Get tested to identify the exact enemy. Step 3. Follow the prescribed treatment accurately and precisely. Step 4. Support yourself with plenty of fluids, diet, and rest. After the course of antibiotics kills the infection, the inflammation will subside, the mucous membrane will heal, and your bladder will once again become that obedient and predictable organ. The urges will disappear, and along with them, your confidence and peace of mind will return. Your health is in your hands. The main thing is to act wisely and consistently. Take care of yourself and your loved ones. Like this video and don't forget to subscribe to the channel. Be well.